next guest?
Yeah, our next guest, her name is Amy Crooks. She's a 2-time breast cancer survivor. She is also a reconstructive surgery advocate. Obviously, when you're diagnosed with breast cancer, sometimes you have to get what they call a mastectomy, and that is one, it could be a single or a double.
Yes.
And we received an email about a very unique breast cancer survivor patient, which is Amy.
Yeah.
Her husband died. She lost her business, and she also got diagnosed with breast cancer twice, all in the past few years. The doctor's office loves her to death. She's a bundle of energy. Many women are afraid of breast reconstruction after breast cancer diagnosis and surgery, and Amy is an advocate and speaker to women, especially young women. She's been helpful to the office and to other doctors, sharing her experience and talking about how happy she is that she made the choice to get reconstruction. Her quotes are infamous, and it would be awesome to get her on the show. So here she is. Obviously,
good morning, gorgeous.
October is Breast Cancer Awareness Month, and here is Amy Crooks. Good morning.
Good morning. I brought you guys some treats here. We got some little booby cookies.
Look at that.
Look at that.
Look at Josh lit up like a Christmas tree.
Is that a nipple?
Yes, that is.
It's Pinocchio's nose.
Look at that.
That was just on.
Thank you so much.
I knew you would love it. I had a feeling.
Thank
I didn't
you.
know if you were taking it to Bang Down with you.
Oh! She listens.
I did not. I researched you guys out.
Okay.
Now, Amy, how long ago were you diagnosed with breast cancer?
It's been 15 months. I got a clear bill of health in September.
All right, baby.
Yes.
Way to go.
I agree. I fought it twice. It came back in 90 days after radiation.
Jesus.
And then lovely Dr. J over there decides he was good. I told him, I said, I'm a widow. We got to make these things high and tight for 50. Let's go. We got to get lucky on this one, man. If we're talking Boomtown, this has got to get me to Boomtown.
Now, so let me ask you this. Your first time you go through, it comes back after radiation.
Yes, sir.
So then they decided to do the mastectomy. Is that correct?
That is correct.
Okay. Now, Dr. J, good morning.
Good morning.
Dr. Jeff Horowitz, who we've had on the show many, many times. Normally, excuse me.
Normally, it's a woman who has lopsided breasts.
Yeah, or
but
so
this time more important.
This is where you get to the serious side of your profession.
Right.
And I want to ask you a couple questions because it being Breast Cancer Awareness Month and everything, and seeing Amy here in such high spirits and all of that, it's fascinating. But let me ask you, when a mastectomy is performed, you obviously take off both breasts. But what is actually removed? I mean, all that tissue inside of there and ducts and milk work and everything?
Yeah. I mean, you don't always take off both breasts, but sometimes you do. Like, for example, in Amy's case, the one breast was taken off for cancer, the other one prophylactically, just to make sure to decrease her risk of it happening in other breasts.
Okay, so that's like a preventive maintenance on the other.
Right.
Okay.
But what you do, the whole breast comes off.
Yep.
And usually with varying degrees of amount of skin. It depends on the general surgeon, how much skin he wants to take off. But in general, you kind of take off a football or an ellipse shaped to skin, and then you just close the skin.
Gotcha.
So the chest is flat.
Yeah. Now, at that point, do you have to remove the nipple?
Well, it's a good question. When I trained, it was, it wasn't a question. It always came off.
Yeah.
Nowadays, I mean, it's still a little cutting edge.
Sure.
That you could, sometimes they try to spare the nipple, but the problem is you leave behind a little bit of breast tissue right under the nipple.
That could have cancer in it.
Exactly right.
Yeah.
Exactly. So most people, they say, look, if we're going to do mastectomy, we're trying to get off as much breast tissue as possible. We're going to take the nipple. And then, so what we do, it's kind of two stages. You reconstruct the breast, but you're really reconstructing a mound. And then to finish it off, you reconstruct the nipples.
How do you make a nipple that's
That's a good
not
question.
there?
I think this is one of the most ingenious things in plastic surgery. You do a little local flap, which means you rearrange the skin in a local way to make a little thing that sticks out. And it's great. It looks just like a nipple, like a
colorization and stuff?
Actually, no, that just looks like skin. But then to get the color, we just do a tattoo.
Is that right?
Yeah, because when you think about it, what is your areola around it?
Yeah.
It's just colored skin.
Yeah, no question.
Yeah, so we used to do skin grafts like from your inner thigh because that skin's a little darker.
Right.
But then somebody smart said, that's too much trouble,
Just tattoo it up.
Yeah, and what I told Amy, there's no rules. You can get whatever color you want. So if you're a Ravens fan.
Which was a mistake.
I'm going with the three-dimensional ones, guys. I can't wait to get a good junk guy on this one. I'll be like, do you see them? I'm there. And they're not there.
And she's talking about Norman Rockwell, and I have no idea what's going on.
She said you wanted to get a Norman Rockwell type painting.
Yes.
Is that like a little kid getting an autograph from a baseball player nipple? Is that what it's going to be?
I'm trying.
Yeah.
No, what me me and my nephew have designed 5 different photographs or art. My photographs, because I did photos of the whole process.
Yeah.
And he made artwork. And one is Norman Rockwell, where I'm laying back getting the nipple tattooed. The other one's not tattooed. And then it says American Cancer Society.
That's amazing.
It's awesome.
Now, listen, people like you, Amy, I've always said this. I guarantee your whole life, you were the life of the party. You were the light in the room.
That's why I don't have a voice. I came from the Stacey Davis Fund from Saturday night.
Right.
And that thing was a blast, and I don't have a voice, and I'm so sorry.
No, listen.
Well.
But it's amazing that people...
My mouth did too much work this week.
Well, hello there.
Now, but Amy, when you see people like you in the face of, it's devastating for a woman, and you seem to be just... You're one of those people that's, well, you know what? It happened, but whatever. I'm going to move on. And that's really where you're at with this, isn't it?
I am, and I think what I learned was people don't talk about this in the support groups.
Yeah.
They're like, you'll be fine, don't worry about it. And I'm like, you gotta be kidding me. Let's take pictures. I think every woman should take pictures of their breasts before they're removed because they're beautiful to me.
Yes.
And I had an artist do it, a photographer, and then she's been doing it all the way through.
Wow, you've kind of documented your entire
whole thing.
process.
I have
Good for you.
75, and I don't have any nips yet, guys.
Right.
We'll have to come back and show you the nips, because I
Right.
can do some fun things with my breasts these days. I'm not kidding you guys. I can make them dance, and it's really funny. And my sister tried it yesterday, and she can't do it with the real ones.
So, in the email, you say that some women are afraid of actually getting breast augmentation after they've had a mastectomy. What is the fear that's involved with that?
I just think you're scared to death, and you don't know what is happening, and you're like, the decision's got to be made quick.
Yeah.
And as a single, I'm a mom with 2 kids.
Sure.
My husband died 3 years ago. I had to go tell my kids I had breast cancer the same day, that's 2 years to my husband's death on the same day.
Oh, God.
And, everything happened so quick. And now I was like, my mom was a breast cancer survivor, and she went flat. And I was like, the stuff that's out there now and the opportunity to have these implants and make you feel like a woman again. And then people buy you beers and you got a cleavage, as you can say. And it makes you feel complete. Now, the people I've talked to help go through this, they ask me questions, and I'm like, it's gonna be painful, it's gonna hurt.
Yeah.
Eat your pain pills, get it done. Because when I would go to Dr. Horowitz's office every Friday, it was a bad lunch engagement for like 6 weeks.
Right.
I lay there, he looks at me, he goes, assume the position, Amy. And I lay there, and then he gets
I have to tell you that.
Because I said, man, I haven't heard that in a couple of years.
So going through this experience, how has it changed your outlook on life?
Oh, dramatically, and I'm glad to speak about it. I'm doing a lot of fundraisers, and I'm doing a buddy system with some other women.
Yeah.
That are scared, and they don't know if they want to get the skin expanders or if they want to do this. But I think it is one of the best thing or opportunity for women to have more choices.
Yeah.
You don't have to do with the padded bra. You don't have to do with just being flat-chested. And the 3-dimensional nipples are actually the coolest thing I've ever seen.
Yeah.
So I'm really excited about finishing the process up here and get some nips on.
That's...
And I think the change of life,
awesome.
the change of life is more than just the breast. I lost my husband after 20 years.
Yeah, wow.
And raised 2 kids. But you can't just sit there and just crumble. I had to, go after it and do it positive. And then when I found out that nobody really was out there talking about it bluntly and rudely, like it's just...
You're in the face about it. That's that's how it breaks through. You can use all the medical terms you want, but when you straight up say, look at these things, I feel like better than I did before I had breast cancer.
That's right.
That's America.
That is America. I don't have funnel cakes anymore.
I'll tell you what, let's stick around. Dr. Jeff and Michelle, of course, and Amy, stick around. We're going to do some commercials and news. When we come back, we'll learn more about it. And Dr. Jeff, you can tell us, for women that are facing this, the process and what they can expect. So stick around. We'll be back.
Nikki, Amelia, and Spiegel.